Hi everyone, and welcome back to my channel. My name's Sophie, and this channel is chronicling my journey of living my best life with multiple chronic health conditions. Today I just want to give sort of an overview of what the year is going to look like medically and how I'm functioning on a day-to-day basis. For the most part, the year is going to be rather boring medically. As far as doctor appointments and stuff go, the only two major things that will be happening is, one, I'm supposed to get a muscle biopsy from the Children's Hospital of Philadelphia, their mitochondrial disease center. I haven't heard from them since I went there in January, so I will be messaging them today, sort of asking them what's going on, is this still happening, and the like. And then I am seeing a doctor at Cleveland Clinic again. It is currently a virtual appointment, but since I have Medicare, and if you're in the United States, you know that at the end of the month, the virtual appointment coverage for Medicare expires. So I did book a hotel for Cleveland because I don't want to miss this appointment, and I would be able to see him in person, just not virtually. I really don't want to go to Cleveland. I would definitely ask them if I could just pay out of pocket to see him virtually. I'd much prefer that. It would be much cheaper than driving to Cleveland. But we'll just have to see how that goes. That came about because I found an article that he authored, and they had found mitochondrial myopathy using invasive cardiopulmonary exercise testing, which I had back in, I want to say 2023, and my results are not as severe as their patient's results, but consistent with their patient results. My abnormalities are in the same direction as their patient. So I wrote the author of the article, not expecting a response or anything, and I think I emailed him on like December 31st or something, and he responded on January 3rd, it was really quick. I don't remember the dates, but it was really fast, inviting me to see him and discuss this. So that's a good sign. I don't think he would invite me for an appointment if he thought if he thought I had something else going on. I did send him a table with my results compared to his patient's results he mentioned in the article. So we'll see how that goes. That appointment is in like the middle of February, so that'll be coming up. One way or another, I will be having that appointment, whether I pay out of pocket, whether Medicare covers it, or whether I have to go to Cleveland. It will be happening. And then, like I said, the muscle biopsy in Philadelphia. So those are the two major things. I don't know other than the appointment, what would come out of Cleveland. He had mentioned repeat testing. He originally had said he wanted to see me in person and do repeat cardiopulmonary exercise testing. And then he said he needed to see like the graphs of what my results were and not just like one data point. He needed to see the whole trend during the exercise testing. So I responded that I was willing to come see him and do the testing again, and I sent him the graphs of my latest CPET because I had them, and then it changed to a virtual appointment. So I don't know if they were convincing, if that's the right word, that I don't need to go in person and redo the test, but we'll find out here in a couple weeks. But other than that, even though I have a lot of things wrong with me, for the most part, except for sort of mitochondrial issues, things are stable. And a lot of the doctors I was seeing, I just no longer see because it was just a waste of money. I'd go there and be like, how you doing? Everything's stable. Okay, see you next year. There's no reason to go to that appointment. So now I just have my primary care doctor that I see a couple times a year because I do pay out of pocket. She is a concierge functional medicine provider. I see my cardiologist twice a year. I see a doctor for the fibromuscular dysplasia once a year. An endocrinologist because my blood sugars are wonky once a year. This will actually be my first time it will be my second time really seeing him. The first time was just doing all the testing, and now since the testing, this is sort of like the year follow-up, and that should be interesting, simply because my blood sugar doesn't really follow a diabetic pattern, and what works for people with diabetes doesn't work for me in terms of walking after a meal, lowering blood sugar and stuff like that. So that's coming up actually tomorrow. I'll probably post this today, so tomorrow on Friday, January 23rd, I see them. I haven't been to my rheumatologist in probably a couple years. I'm no longer taking Plaquenil because the thought was maybe I had Plaquenil toxicity causing the heart failure. And if I'm not taking the medication and all they do is sort of do labs and say the labs look fine, my primary doctor can look at labs and say the labs look fine. No reason to spend money there. Gastroenterology, I have a follow-up scheduled for February that I plan on canceling. Everything's stable in that area, nothing's going on. And I really didn't like that I would always see someone different when I went there. So I am considering changing my gastroenterologist, which is a bummer because I liked the doctor, but they've been going through NPs quite a lot. So I saw a new NP this past time and they didn't really know any of my history, so that's always annoying. If I'm not able to see the same provider every time, considering how complex my history is, like it's too much for a new person to jump in every time. So I either need to talk with them that I need to see the doctor every time, or I'm gonna find someone else. I really don't know if I need continuing follow-ups unless something's going on, because my GI issues are pretty stable. I can't swallow very well, my esophagus doesn't really work. I get esophageal spasms that just sort of happen sometimes. But, I mean, that's just how it is. The dietitian I probably won't continue seeing much longer. I am paying out of pocket for that. Medicare only covers it for specific diagnoses and only for 3 visits. And at this point I know what I need to do for my diet, it's just doing it. The hematologist no longer needs to see me. They've decided I do not have antithrombin deficiency. My antithrombin activity is low, but not low enough to be diagnosed, even though my genetic mutation was likely pathogenic. And the nephrologist, I would just go, they would do an ultrasound of my kidneys to make sure they weren't enlarged, ask if I'm still having trouble urinating and if I'm still cathing myself, and that was really all. So that was not worth it. And then lastly, I have a psychiatric NP who I continue to see every few months. Another one I don't really need to see, but I've been seeing her since like 2017, 2016. She's literally the only person I think who knows what I was like before my health plummeted. So it's just nice to be able to talk to someone who knew me before things got as bad as they are. So there shouldn't be a lot of doctor appointments this year. There should just be like a handful, which will be nice. But the muscle biopsy and the Cleveland Clinic appointment are the major things that could change the path of, or could change management of my current condition, I suppose you could say. I don't really have time to talk about how I've been doing, so save that for another video that I will be recording right after this one. So there will be a video next week, honest guys. But that's going to be it for this one. It was pretty long, but that's sort of, those are the doctors I see. But yeah, we are bracing for a huge snow event over the weekend in the mid-Atlantic, so that should be fun. Thankfully, since I live in a condo now, even though I'm having all these problems with the leaking and construction and whatnot, I don't have to shovel snow, so I'm very happy about that. Anyway, that's going to do it for this one. Again, apologies, it's been so long, and I'm still so inconsistent posting. I'm still dealing with a lot of construction stuff, but it's getting there. Anyway, hope you're having a good day whenever you see this, and I will see you in the next one. Bye, guys.